My name is April Chen. You all know me, most everybody. A licensed master social worker. One of my specialties is working with kids in the school system. Therapists are the first to notice when a kiddo is struggling emotionally. What we found is that if they're struggling emotionally, socially, or academically, but we are seeing epidemics increase like DMDD, like disruptive mood dysregulation disorders. What I'm finding with some of the kiddos I work with too, they're being placed and allowed to use a lot of technology. It increases their anxiety, depression, self-harming behaviors, all those things. So as therapists, we're like the first ones to notice. And if we understand the basics of school advocacy, we can serve as crucial bridges, right, between families and schools and ensure that kids' needs are met. Because sometimes with class sizes, especially in the different Montgomery County being large, Howard County being large, PG County being large, the kids that are on IEPs and 504s get lost in the system. And so that's how we as therapists, I was thinking, could identify some of that. Today's presentation will discuss is when should we recommend a neuropsychological evaluation? Do you guys understand the difference between an IEP and a 504 plan?
My understanding of it is that the IEP is for the academic piece and the accommodations that the child would need academically, and the 504 is a behavior plan.
That's definitely correct. Hey, Chris, go ahead.
From my experience, it was like they give you extra time and just very engageful and mindful of your situation. So like taking things a little bit slower compared to other students who get things quickly. So that's my experience.
That's awesome, Chris. Thank you very much. That's one of the things. So 504 plans are usually for what they call OHI, which stands for other health impairment. So like things like ADHD or cognitive processing difficulties. The 504 plan provides the behavioral supports and educational accommodations, preferential seating, and all those things. But then it advances with the IEP and it's specialized instruction. They measure the progress, they do benchmarks, and they attempt to do individualized instruction. However, sometimes in some of these cases, what happens is that the child's needs are not being met. As a professional, I will ask the parents, how do you feel about getting a neuropsychological evaluation? So when there's a significant gap between potential and actual performance, behaviors present like aggression, withdrawal, like school refusal, things like that, and they don't improve, given the standard interventions that are written into these plans, that's when I usually recommend a neuropsychological evaluation.